Today, we're looking at a pretty cool medical innovation that could really change the game for how doctors treat one of the most common chronic diseases in kids. It all comes from a research paper about a new, much simpler way to use ultrasound to track arthritis. So let's jump right in. So let me start with a question for you. How exactly do you keep tabs on a disease that might be causing damage on the inside, even when the person seems totally fine on the outside? I mean, that's the massive challenge facing doctors who treat children with arthritis every single day. Okay, so before we can really appreciate the new solution, we've got to understand the problem. So this first part is all about the unique challenges that come with something called juvenile idiopathic arthritis. So what is JIA? Well, it's the most common chronic rheumatic disease in children, period. You can think of it as an autoimmune condition where the body's own immune system gets confused and starts attacking the joints, which causes inflammation. And the stakes here are really, really high. Because if you don't get it under control, it can cause permanent damage to a child's bones while they're still growing. But here's the really tricky part, the hidden enemy, if you will. It's something called subclinical synovitis. Now that's a fancy term, but all it means is that inflammation can be active, quietly damaging the joints even when a child has no outward symptoms. They might not feel any pain, the doctor might not see any swelling, but the disease is still there, doing its work. Right, so this whole hidden disease problem means that doctors desperately need better tools to see what's really going on. And that brings us to why they needed a whole new way to look inside the joint. Think about it. A standard physical exam is absolutely essential, but it can only tell you so much. A doctor can feel for swelling, they can ask about pain, but their eyes can't see that hidden subclinical inflammation. And that's where ultrasound imaging comes into play. It's totally safe, no radiation, and it gives doctors a direct window inside the joint so they can see that inflammation with their own two eyes. But, even with ultrasound, it wasn't a perfect fix. There were some big challenges. Some of the scoring methods were just incredibly time-consuming. Imagine having to scan and score every single little joint. It just wasn't practical for a busy clinic. So others tried to simplify things by just picking one indicator joint. But what if the worst inflammation isn't happening in that one joint? You could miss the big picture entirely. Doctors needed the best of both worlds, something fast and comprehensive. And that gap, is what brings us to the hero of our story today, a brand new score called MUSS. That stands for the Musculoskeletal Ultrasound Sum Score. The beauty of MUSS is its brilliant simplicity. It's designed to do one thing and do it incredibly well. Capture the maximum level of inflammatory activity happening anywhere in the body without getting bogged down in scoring every single joint. The highest possible score is a 6. So, how does it work? This is so clever. The doctor scans all the joints they're worried about. Then, across all of those different scans, they look for just two things. First, the single highest score for swelling. Second, the single highest score for inflammation, which they can see by looking at blood flow. And here's the genius part. Those two highest scores can come from two completely different joints. You just find the worst swelling, find the worst inflammation, add those two numbers together, and bam, that's your USS score. A really good way to think about it is like a fire inspector checking a building. The inspector isn't going to waste time counting every single tiny spark, right? No, they're going to find the two most important things. Where is the biggest fire and where is the thickest smoke? That gives them the fastest, most accurate picture of the overall danger. Well, MUSS basically does the exact same thing for joint inflammation. Okay, so it sounds great in theory, but does it actually work in the real world with real patients? Well, to find out, researchers put MMSU through its paces in a year-long follow-up study. So they got a group of 33 children who had just gotten their JIA diagnosis. Some of them had the type that affects just a few joints, and others had the kind that affects many. And we're talking about really little kids here. The median age was only around 4 or 5 years old. And they didn't just check in once. They followed these kids for a whole year. They collected all the clinical data and did the ultrasounds right when they were diagnosed, and then again at a few follow-up visits over the next 12 months to track their progress. All right, so here's the million-dollar question. After all that, did it actually work? Let's get to what the study found out about MUS. The first big finding was a huge, resounding yes. As the kids started getting better on their treatments, less pain, less swelling, their MUS scores went down right along with them. It perfectly mirrored their clinical improvement, which is exactly what you want to see. But the researchers wanted to push it further. They asked another really crucial question. Just how good is this MUSS score at telling a doctor if there's any active disease hiding somewhere in the body? And the answer they found was just wow, 100%. The score had what's called 100% specificity. Now, what that means in plain English is that if a child had a MUSS score of 1 or higher, it was a guaranteed sign that there was active disease somewhere. There are 0 false positives. It's an unbelievably strong signal for a doctor to have. So, what about the tools doctors already use and trust, the so-called gold standards? How did MUSS stack up? Well, it correlated beautifully. It had a very strong connection with the main clinical score doctors use, and also with the doctor's own overall assessment of how the patient was doing. It even had a strong correlation with how the parents and kids themselves felt. It just fit perfectly into the whole clinical picture. Okay, so let's pull back and look at the big picture. We've got all this great data, but what does a simple score like MUSS actually mean for the kids and families living with this disease every day? Well, it's about so much more than just a number on a page. This is about giving doctors a more powerful tool. It gives them a fast, reliable, and big picture view of what the disease is doing in real time. And that allows them to make those critical treatment decisions with way more confidence. And hey, you don't have to take my word for it. The researchers themselves put it perfectly in their conclusion. They said that MUSS could be a key piece of the puzzle that helps a doctor decide, okay, is it time to step up this child's treatment to get that hidden inflammation under control before it causes permanent damage? So let's wrap this all up. What's the bottom line? First, MUSS is a simple, practical tool that can actually be used in a busy clinic. Second, if you see a score of 1 or more, that is a huge red flag for active disease. And finally, this could help doctors personalize treatment for each kid, hopefully preventing lifelong joint damage. Now, of course, this is just one study, and more research is needed. But man, what a promising start. And all this really leaves us with one final and pretty hopeful question. In a world of incredibly complex medicine, could it be that a simpler, more elegant score is actually the key to helping children with arthritis live longer, healthier lives?